Good afternoon, everyone. I'll do a quick mic test of each speaker and moderator present here first. Kindly unmute yourself and say hello. Thank you so much. We will begin shortly.
Hello, this is OP Singh.
Yes, it's audible.
Yeah, hello, I'm Manjeet Saluja from WHO. I hope I'm audible.
Yes, sir. Good afternoon, sir. Yes, sir.
Great.
Hi, this is Anita Mia from Aga Khan Agency for Habitat.
Yes, ma'am, you're audible.
Okay.
Good afternoon. This is Pankaj Mathur, UNICEF India. Can you hear me?
Yes, sir, we can hear you.
Thank you.
Thank you.
Good afternoon. This is Arundhati Muralidharan from WaterAid. Pleasure to be here.
Good afternoon, ma'am. Yes, you're audible. We'll start at 4 p.m., 4 o'clock sharp. Waiting for others to join. Very good evening to everyone, and thank you so much for joining us on the time for our COVID 19 Academy panel discussion. As you know, the COVID 19 Academy is a joint capacity building initiative of NIDM, UNICEF, WHO India, Excel Foundation, and Sphere India for volunteers and outreach workers across the country. Today, we have a special panel discussion for Global Hand Washing Day. As we know, it's celebrated on 15th of October. So, Global Hand Washing Day is a worldwide advocacy day dedicated to raising awareness of the importance of hand hygiene, primarily through hand washing with soap, and causing a lasting shift from policy to community driven actions. The Global Hand Washing Day theme this year focuses on the links between hand washing and food, including nutrition and food hygiene. Hand hygiene for everyone is a call to action to make hand hygiene a practice for all. It's the 2020 GHD theme also. This theme is in line with the new initiative led by WHO and UNICEF on hand hygiene for all. We'll be introducing our panelists to share their expertise today in a very short time. Kindly remain with us. Hello everyone. So I'll start introducing our panelists. First, we have Professor Dr. Anil Kumar Gupta. Anil Kumar Gupta from NIDM. He's a sustainability risk management strategist working in the area of disaster management, environment, and climate resilience for more than 25 years with national, subnational, and business administration. He steered international and national projects of policy research, planning, and capacity building and established new approaches. We're delighted to have you here, sir. Next up, we have Mr. Pankaj Mathur from UNICEF. Mr. Pankaj Mathur is working as a water sanitation and hygiene specialist with UNICEF India, presently posted in MP Madhya Pradesh, Bhopal. He has varied experience of 24 years in water, environmental sanitation, urban development, disaster risk reduction, and public procurement with national and international agencies. He has also supported national and state governments in achieving universal access to wash services in communities and institutions. Thank you so much, sir, for being with us today. Next up, we have Ms. Anita from Aga Khan Agency for Habitat India. Ms. Anita carries more than 27 years of extensive experience in social development with a strong passion for community led development. Her skills are underpinned by the hands of on management of diverse initiatives as water management, environment, sanitation, and climate change in the social development space. Currently, she is currently holding the position for environment planning programs for the Aga Khan Agency for Habitat India. Thank you so much for joining, ma'am. Next up, we have Ms. Mamta Bakshi from the Cosmos Foundation. Ms. Mamta has 30 years of experience in development sector, recipient of Alumni Achievement Award, Department of Human Development and Family Studies from MS University, Vadodara, 2012. She has an enriched experience in planning, implementation, budgeting, and monitoring of CSR programs, building partnership with government and private organizations. Along with that, she has also worked on the grassroots level for rural India. Next up, we have Dr. Om Prakash Singh from Save the Children India. Om Prakash Singh, he is a PhD and a postgraduate in health management with graduation in pharma, over 16 years of demonstrated experience in health project and program management positions. He also has demonstrated experience in managing multiple health and nutrition projects, designing and development health business proposals, strategies, and interventions as well. He has also worked with different state government, academic institutions, UN, and NGOs as well. Thank you so much, sir, for being with us today. Next up, we have Ms. Shalini Prasad. Ms. Shalini is working as a communication for development specialist with UNICEF India since 2011, supporting key communication initiatives on water sanitation and hygiene, as well as disaster risk reduction. She has more than 20 years of experience in development sector and has worked with the various national and international organizations, including WHO, USAID, Population Council, Plan International, focusing on advocacy and program communication. Thank you, ma'am, for being with us today. Next up, we have Mr. Kapil Dev Singh from IQVIA. He is the Associate Director of Public Health in IQVIA, and he has an MBA healthcare management with over 13 years of experience in healthcare sector. He has also extensive experience of working with international institutions, government, and multilateral and bilateral organizations and universities such as state health departments, MOHFW, the World Bank, UNICEF, WHO, UNDP, and others. Next up, we welcome you, sir. Next up, we have Dr. Aravindan KP from Kerala Shastra Sahitya Parishad. He is a retired pathology professor and People's Science Movement leader. Thank you, sir. Welcome to the session. Next up, we have Mr. Sujoy Majumdar from UNICEF again. Mr. Sujoy is a water sanitation hygiene specialist working with UNICEF India. He has been an IFIS officer and has also worked in Swachh Bharat Mission and National Rural Drinking Water Program of Government of India. He is supporting the COVID-19 response on WASH of UNICEF India. Thank you for joining us, sir. Next up, we have Mr. Manjeet from WHO. Mr. Manjeet has been working in the area of environment and development since last 2 decades. He currently works with WHO Country Office in India as a technical officer for environmental health, and that includes the issues of water, sanitation, climate change, air pollution, etc. He has also worked with Indo-German Environment Partnership with GIZ as well as with UNDP, and also Planning Department Government for Uttar Pradesh. He has also worked with various international and national NGOs in various states of India. And we have a moderator for today, Dr. Arundhati Muralidharan. Dr. Arundhati works with WaterAid India and policy team, leading work on the integration of water, sanitation, and hygiene into allied sectors of health, nutrition, and education. She strongly believes that the hygiene promotion and behavior change can be simply and impactfully incorporated into health and nutrition initiatives, and is passionate advocate of menstrual health and hygiene in India and globally. Dr. Arundhati is a public health professional and researcher with 15 years of experience in the development sector working. So these are all our panelists for today. I'll request Dr. Arundhati now to step in and take the session forward. Thank you so much, ma'am.
Thank you very, very much, and a very good afternoon to all of you, and wishing everyone an eventful and a forward-looking Global Hand Washing Day, where we can all come together to commit to hand washing for all. We have a great lineup of panelists today, and our request to them is to focus more on providing some key insights into the various solutions that we all need to hear, both from a hardware or an infrastructure point of view, as well as from a behavior change point of view, how we can work with communities, how we can work with government, as well as other important stakeholders. We will have, we all understand the context and the need for hand washing and how important hand washing is as a first line of defense against COVID-19, but also a host of other infectious diseases. So I request you to spend, all our panelists to spend a little less time on the context and really to dwell and focus on the solutions that we can all begin to engage with. And on that note, I'd like to turn over to our first panelist, Manjeet from WHO. Now, WHO has been leading efforts globally as well as in the country, along with other partners, to bring focus on hand hygiene for all. So Manjeet, I'd like you to set the context for why hand washing with soap is so critical for us in terms of a cost-effective public health intervention. Over to you.
Thank you, Arundhati. Thanks for this introduction, and also thanks to kind of Sphere for organizing this very important webinar as a part of the COVID Academy efforts for the Global Hand Washing Day. And I think I join Arundhati, and also kind of I see in the chat that there are a lot of people wishing, sending wishes for this particular day. So I join all of you in kind of wishing you for this very important day, and kind of again reiterating the fact that washing the hands kind of is directly linked to saving lives. So that's the kind of importance. So, and I think, as you have already indicated, that as we are going through this pandemic, where hand washing is the biggest weapon, if I can say, against the coronavirus, and the numbers as it stands today, I think just looking at it, that more than 38 million affected and more than 1 million dead. And globally, many of whom would have been kind of with us amongst that 1 million, which have kind of left us, if we had made hand washing practice a little more effectively. So that's the kind of importance of this, and these numbers are huge just from the COVID. And as I think you said that, but even like for a moment we don't think about COVID and we say that there's no COVID, and still hand washing remains a very, very important tool to kind of reduce the burden of diseases on this planet in a very, very substantial way. And this is true both in the community perspective and from a healthcare perspective as well. And many co-benefits could be realized by safely managing the wash services and applying these good hygiene practices. So if we look at the evidence kind of globally, since you have said me to kind of set the context, so I'll just spend 1 or 2 minutes in this, and kind of then move on to as to what WHO is doing and where the solutions lie. In terms of looking at the evidence, where washing hands when the pathogen transmission is most likely to happen, it reduces the diarrheal diseases by kind of a substantial amount, maybe by 47%, and respiratory infections by 23%, which kind of conferring tremendous health benefits by averting these two prominent, which kind of causes of child mortality in India. And we also look at kind of there's a huge gap as the data shows. The National Sample Survey round of 2018-19 kind of really revealed that there are many kind of household members which did not kind of were washing hands before eating, while a substantial amount, more than 3/4, cleaned their hands with soap after defecation. So there is kind of a lot of knowledge gaps and kind of barriers which exist on hand washing behaviors that certainly kind of lead to these inconsistent behaviors and practices. And looking at this is just from the community side, but looking more at the kind of healthcare sector, where kind of hand hygiene is described by many healthcare workers as the single most important tool in preventing the spread of these healthcare associated infections between patients. And what is the importance of these so-called healthcare associated? It kind of implies a prolonged hospital stay, because more people kind of get infected with other new infections, and the hospital stay becomes longer. It could kind of lead to disability. It could increase, and then certainly kind of for treating these infections, you need more antibiotics, which is kind of leading to, and again they are not being followed in a proper way, so certainly leading to an increased resistance of microorganisms to these antimicrobes, and AMR is becoming a big issue. And the burden of disease of AMR may be kind of in many multiples than what we are seeing even for what we are seeing in COVID. And then certainly kind of putting family in a massive additional financial burden, and kind of leading to excess of debts and high cost for health systems, and the emotional stress for patients and their families. So that's the kind of the impact of these healthcare associated infections when we kind of see. And when we said, although the risk of acquiring these HCAIs, kind of healthcare infections, is universal and pervades every healthcare facility and system around the world, and the global burden is again, and the problem is that the global burden is also kind of much of it is unknown, because the difficulty of gathering reliable diagnostic data, and this is mainly kind of due to the complexity and the lack of uniformity of criteria which is kind of used in diagnosing healthcare associated infections, and to the fact that surveillance system for HCAIs are also kind of virtually non-existent in most of the countries. So that's where we do not even know as to how much loss, or how much kind of loss is it really causing to us. So that's another kind of area which needs to be brought into focus. And then HAI can kind of certainly affect patients in any type of setting, where kind of when they are receiving care, when they are in the hospital, but also they can appear when they, even after they are discharged, and kind of again which can lead back to the hospitalization. And also looking at kind of globally, this burden is certainly more and more disproportionate in the developing countries, and even though developed countries are also not spared with this, but the burden is certainly more in the kind of in the developing countries. And if we look at the pathway, the transmission, what happens kind of of these kind of the contaminated hands of the healthcare workers is the most common pattern in kind of, and mainly there are 5 sequential steps which take place. the organisms are kind of present on the patient's skin or have been shed into the kind of objects which are immediately surrounding the patient, so that people pick it from there. Organisms may be kind of transferred to the hands of the healthcare workers, and kind of it gets transmitted from there. The organisms kind of must be capable for surviving for at least kind of several minutes on the hands of the healthcare workers, and then when they are kind of there, and whatever the person touches, it kind of leads from there. Hand washing by the healthcare worker maybe is inadequate or omitted entirely, and the agent used for hand washing is inappropriate. As you kind of said, soap as the most effective, but again, if not a proper timing has been followed, again it becomes infective and it leads to kind of transmission. And then the contaminated hand or the hands of the caregiver may come into direct contact with another patient, or maybe an inanimate object that will come into the direct contact with the patient, and that's where kind of so this is the pathway in a healthcare setting when this transmission kind of how it kind of transmits. And that's where WHO has kind of recommended 5 moments of hand hygiene. So and there are these kind of for a healthcare worker, which certainly kind of includes hand washing before touching the patient, after the patient's kind of a cleaning procedure, after touching the patient's body fluids, and after touching the patient's kind of the surroundings. So WHO kind of gives that recommendation of these 5 moments of hand hygiene, which becomes very important. And also in terms of the procedure and the timing as to how the hand washing has to be followed and what is the kind of particular timings. Just to be very brief in terms of what is WHO and the world kind of doing about it. So this is not a new issue. Agencies, I think global agencies have been kind of talking about it. In 2005, WHO launched the first global patient safety challenge, Clean Care is Safer Care, to which almost some kind of 142 countries pledged their commitments, which kind of allowed to initiate powerful actions to reduce infections occurring during the healthcare delivery through the promotion of these infection prevention control measures and improvements in WASH. So based on this strong foundation, the Save Lives, Clean Your Hands global campaign was kind of launched in 2009. And again, furthermore, the 2018 global call to action on WASH in healthcare facilities, which was given by the United Nations Secretary General, has kind of elevated this issue among all the UN agencies and partners and the member states, which kind of and based on this kind of global call, all 194 member states of WHO unanimously approved a resolution on WASH in HCFs at the 2019 World Health Assembly as well. So that's where kind of the world is already moving towards it, and kind of there have been various actions which have been there. So in terms of solution, there's certainly a kind of consensus that the urgent action is needed to kind of prevent and control the spread of antibiotic resistant organisms, and in healthcare effective kind of prevention, control and control is kind of one of the most effective solutions for this. And even if kind of looking at in terms of the solutions, first of all, from a community perspective, the solution certainly lies in the intersectoral kind of coordination, because again, hand hygiene, there's not one single department which is responsible for it. So there's a kind of clear intersectoral collaboration which needs to be there, which kind of will synergize coordination between the health and the non-health sectors, and between the governments and even the kind of private and the civil society agencies. And then coming on to the second is risk communication becomes certainly another important area to deal with these kind of challenges. Appropriate messages need to be developed and to be made kind of more context specific and local languages. And then apart from even the development of message, there need to be availability of the hand hygiene infrastructure, because what we see from the National Sample Survey round, there's kind of the hand hygiene infrastructure, whether it is in slums or kind of low resource settings or even in the healthcare facilities, I think that needs to be adequately strengthened, because and again, adequate availability of soaps, whether it's in public toilets, disinfectants, and kind of availability of hospital logistics, including the so-called kind of where we are talking about the personal protective equipment needs to be kind of ensured. So that's where we kind of what we are kind of talking about in terms of in terms of the solutions. So I think I'll stop here and maybe give it to the other panelists to kind of dwell deeper. But that's it from my side. Over to you, Arundhati. Thank you.
Thank you very much, Manjeet, and thanks for highlighting how the lack of hand washing has huge healthcare costs, both for families as well as for the health system, and also kind of making that link, which we often don't make, between how important a preventive measure is and the lack of it actually takes us into the realm of healthcare, which in itself poses several risks. So thank you for highlighting those components. We're going to go to Dr. Anil. And so Dr. Anil, given that we are in a public health emergency, public health crisis, how do you see the role of hand washing when we're dealing with such emergency situations? Right now, we're faced in COVID, but we've had other emergencies in the past, and we will have emergencies in the future. So, what is your take on how we better promote hand washing in such emergency situations? Over to you, sir.
Thank you for taking this initiative of organizing this discourse today on very pertinent topic, that is on hand washing. And as I was listening to Mr. Manjeet from WHO and the kind of a background of this webinar today, hand washing becomes important from several angles. And yes, this coronavirus pandemic, we are still not clear which phase actually we are in, whether we are towards the end of this pandemic or we are still in the middle of the pandemic, or what. So there are several questions, when particularly when there has been a second wave kind of issues also. Then in India also, again, we are having festival season. So what may be the scenario? We have a lot of questions. And during this pandemic, the importance of hand washing and hygiene has already been emphasized, and we have learned the importance of hand washing. But it is not that the hand washing is important only in the coronavirus pandemic period, but in fact, hand washing is important for several dimensions. And as Mr. Manjeet was referring to health, I would tell here that if we organize some kind of a discussion or discourse, for example, this one on hand washing, the things looks so simple that why so much of scientific and a detailed deliberation on this simpler issue, that is hand washing. Whereas if we look at the impact of whether ineffective hand washing or not having the habit of the hand washing, and then looking into its in terms of its consequence, so we find that hand washing is very critical dimension within the domain of public health, but also within the domain of climate change adaptation, and also important from the disaster risk reduction point of view. Because in disaster risk reduction, we have two important aspects, and both are very important. One is hazard and other is vulnerability. So poor health and poor capacity of the people to cope up with the emerging challenging situation. So that is a major attribute of vulnerability, and poor hand washing that leads to poor health and the severe health consequences, also overburden on the health facilities. So all this contributes to the vulnerability of our system, vulnerability of the people themselves. So this is important, but despite of all such discourses at various levels, still I find that many people, and even sometimes the people who are highly educated and look affluent, they also tend to take this issue sometimes casually. So these are the kind of issues that cause some worry also. We also know that more than 70% of the disasters are related with the hydrometeorological risks, which are associated with water, climate, and the temperature kind of things. And that has direct bearing of the impact of these kind of disasters on health, and the pathway of affecting health is primarily the kind of a poor hygienic conditions, poor waste management systems, poor issues. And as during flood, we find that water everywhere. There is no water to drink. So water to drink does not indicate only the water for drinking, but the amount of water for various uses of the people, and to enable better nutrition, but also better hygiene. So hygiene becomes a very important center point, even when we discuss about the design of shelters and the parameters for safe relief shelters, are effective relief, the better relief shelters also. There also, in fact, the water sanitation issues becomes very important. So here, water sanitation, how for water and sanitation, we are considering that the practice of hand washing as a critical aspect. But saying again what I was referring to, that though it looks simpler, but bringing this shift and bringing this thing into a core focus, the hand washing into the kind of a very common habit of the people, the things doesn't look very easy. It requires the issue of behavioral change. So that is a social and psychological dimension. It also requires the environmental issues. For example, the availability of the resources, availability of not only the disinfectants, but primarily availability of water. Many times, many places, we find that there is a lack of availability of water. That also creates challenge. And then even with water is available, that is not fit for use. And these kind of things are often seen in, if we look at the urban areas, we look at the urban fringes, slum areas, peri-urban areas, and those are the areas that are the receiving end of the sewage and the waste, garbage, discharges, emissions. All those things fall into these urban fringes and the peri-urban areas. And the people who are living there, they occupying those areas, are not having their own capacities in themselves, so they have to depend on the civic amenities. But many times the civic amenities, despite of its sometimes the civic amenities are present, but they are not in that condition to provide regular supplies or the regular services. So those are also the issues, and that is why we have been also working with the several agencies, including UNICEF, Sphere India also, and many other agencies, CDKN also, to see that how the climate change adaptation objectives can be achieved by focusing on the improving people's habit of hand washing, then better amenities for water and sanitation, better maintenance of these kind of services, so on, particularly for the urban poor. But on the other hand, in rural areas also, this is very important dimension, because in rural areas, people have gone into some kind of a degradation of their habits. Because if you look at the ancient literature, these things, hand washing has been a very common practice in the ancient cultures. But now there has been a lot of recession, and so probably somehow we find that there is a linkage between the scarcity of water, or the availability of good quality water, easy access to water, with the hand washing practice. So we have to we should not ignore that dimension also, as we have seen that during the period of reverse migration from urban areas to rural areas during this coronavirus pandemic period. We found that the lot of people, when they reached back to their villages, so the systems and amenities and infrastructure in villages were under tremendous pressure, and the habit of those people were not actually neither rural nor actually urban. So they were in between, and that actually posed additional pressure. So these are also the questions that how the standards are flouted, and how the situations arise which are not common. Then
sorry, Dr. Anil, if you could just take another minute. I'm a bit of a tight schedule.
I'm going to summarize it. So we have to look at this hand washing issue from personal hygiene point of view, but also from community health perspective, and also for reducing the burden on the health system. So hand washing would be the promoting of this culture and practice of hand washing would be of multiple benefits. and therefore I am very happy, and I extend my best wishes to the organizing team and all the participants of today's webinar. Thank you very much.
Thank you very much, sir. We're now going to proceed to Pankaj Mathur. Pankaj ji, welcome. Pankaj ji works with UNICEF, and they have supported the several state governments, especially Madhya Pradesh, in really looking at taking hand washing to scale. Before Pankaj ji, you start, just requesting all our panelists, given that we're on a bit of a tight schedule and we have several speakers, to keep your intervention focused on the solution, and please try speaking just for 5 minutes so that we can hear everyone's voices and we also have enough time for Q&A. Requesting all the audience to please type in your questions in the Q&A box, and panelists, please do look at those questions and feel free to type in your answers. Pankaj ji, over to you to hear about the Madhya Pradesh experience.
Thank you very much, Arundhati, and thank you very much for inviting me here. When I really saw the agenda, there were two specific things which were there in my name. One was about the impact of hand washing at the global level, and then also identifying and then sharing some of the success practices which have been there in terms of scaling up hand washing. So I just have a very small presentation, 5 minutes presentation, and then maybe the presentation will be able to highlight the key solutions and the area where UNICEF has been working. So can I share my screen?
Please do, Pankaj ji, but just avoid all the background context. If we could just
Sure, I will do that.
So please do share your screen.
So can you share my presentation? See my presentation?
Yes, if you could just do a full screen, that will make it clearer.
Sure. Okay, so I'll not go into the evidence of whatever is happening here, because Dr. Manjeet has tried to do it. But the summary of this slide is that either half to 1/3 of the facilities at the household level, or maybe healthcare or the schools, do not have the hand washing facilities. This is the latest evidence which is coming. But when we really see in context of COVID, hand washing access in the public places, it is really very important to highlight that there is no data available. That is what is happening at the public places, because when we really talk about hand washing, and specifically in those areas where people do not have access either to water or soap or sanitizers, so this is the update. That is the reason, this year's Global Hand Washing Day is talking about hand hygiene for all. I'm not going to the detail of that, but this 360-degree view on the hand hygiene for all is really very important. Why we are actually, talking about this 360-degree view for the hand hygiene? Because it talks about the health impact. And when we really see in context of COVID this year, this is the very important aspect which needs to be highlighted, that hand washing with soap is one of the keys in terms of fighting with COVID. And there are also evidences coming that it can actually reduce 36% of the COVID infections. I think Shalini is going to be focusing more on the behavior change aspect. I'll not talk much about that, but again, in terms of reducing the IMR, this really is a very important behavior, be it at the facility level, be it at the household level or the community level. And Dr. Manjeet also tried to talk about the policy coordination, regulation, and financing is something which is really very important. So I think we need to see the hand hygiene in a totality, not just talking about one or two specific aspects, because now the time has come and COVID has provided an opportunity for scaling it up at a level where we can actually see maybe in couple of years, the way we have been talking about toilets for all or water for all, hand hygiene for all has to be has to become a reality. That is the reason GSG 2020 is now focusing, be it households, public places, healthcare facilities, or schools, talking about the universalization, be it the facility or the consumables or the behaviors or the monitoring or the promotion, awareness, everything. So this is something which is now coming up in a big way. And again, there are three specific building blocks which are required in terms of solutions. Multi-sector coordination, which has already been talked about. The second important aspect is systems, policy planning, and financing. I think now more and more national flagship programs, be it Swachh Bharat Mission or JJM or maybe NHM or maybe Poshan Abhiyan, are talking about the importance of hand washing. And COVID again has highlighted the issue like anything. And the important aspect of evidence and learning is something which one needs to put. It's a kind of a fuel which has to be there in the sector for all the times, because people need to learn what are the evidences coming, what is the learning, what are the best practices which are there. When we really see the Global Hand Washing Day over the years, it's the 12th year which we are actually celebrating. But when we really see in terms of highlighting the issue and upscaling, it has now moved from a partner-led kind of an event on 15th of October to now talking about sector policies and priorities in the national flagship programs, expansion from wash sector to all sectors, also maybe it health or nutrition or education, and making it a public movement. And this year, again, in the COVID context, it is talking about a mass movement and talking about, a specific COVID sensitive hand washing units where the technological innovations are there. And then we must have actually seen, a lot of innovations happening around it. I was actually, supposed to be sharing one important aspect of this, which is about, how it can be made a bigger, agenda in terms of taking global hand washing to a larger scale, coming up from Madhya Pradesh in 2014, where a Guinness record was actually made, where almost more than 1.2 million students created a new record by washing their hand at the same time in more than 13,000 schools at different locations, 51 districts of Madhya Pradesh. But the important aspect here is it required a step-by-step approach to bringing all the partners together, but again at the same time the highest level advocacy and buy-in from the topmost political leadership in this state to bringing people together, going for large scale capacity building, and also putting up some kind of specific systems for facility for behaviors, and also lastly importantly documenting and sharing with everybody. So Madhya Pradesh has this kind of initiatives which have been helping making hand washing with soap an agenda of the sector policies, sector practices, as well as sector monitoring. So this is something which needs to be shared with everybody, that how one state can do and then how different states can also do. So when we really see UNICEF in context of COVID, I think Suja is also going to put some light on that. But important aspect Dr. Manjeet talked about is the risk communication and community engagement is something which needs to be talked about. And also we need to focus on infection prevention control, specifically in communities, healthcare facilities, as well as the schools. So this is how UNICEF has been able to mobilize almost more than 150 lakhs units across the country, 74 lakhs soaps and sanitizers, capacity building of more than 200,000 people, and also bringing COVID sensitive communication material and modules. So I mean the important aspect here is it has to be made a kind of public agenda. So not a single agency can push it or pull it, but it has to be I mean almost everywhere. When I really say that a long lasting campaign and innovative methods of promoting behaviors as well as technologies. So I think this is now time to take a pledge on commitment to make a hand washing with soap a reality for all. And I think COVID has given enough opportunities this year. Everybody is talking about it. When I really see today Facebook, different social media platforms, they are filled with different agencies, different people coming together, and then sharing their experiences and making it a bigger movement, a larger movement. So that's all from my side. I don't think anything specific to be added, but again, technology is something which needs to be continuously evolved, continuously innovated. When we really talk about reaching to the far-flung areas of the country with the behavior of hand washing with soap. So thank you very much from my side. Thank you.
Pankaj, thank you. And thank you for highlighting the importance of hand hygiene for all as a public agenda and looking at sector coordination, sector strengthening on this. We now want to hear from Mrs. Anita Mia from the Aga Khan Development Network. And Anita ji, if you could talk more about the practical solutions for hand hygiene facilities. How can we make this more responsive for, and meeting the needs of individuals and communities?
Yeah, thank you all of you for giving me this opportunity to connect with you. I will, as Aga Khan Agency for Habitat, we are more of as an implementation agency. So before COVID, we had, we were working a lot on hand and hygiene in Gujarat and in Maharashtra with school children, with communities in peri-urban and rural areas. So suddenly after the lockdown, and then we realized how do we connect communities and hygiene was becoming the central stage of COVID the pandemic. So then we started working out how do we, reach to the communities with this solution without physically meeting them. So I will present two type of scenarios. One scenario is where there is some kind of an infrastructure at the community level in rural areas, and awareness needed to be created, but there are few areas where there is no water availability, there is no specific infrastructure for hand wash stations, like in tribal areas of Palghar district in Maharashtra, where we are working in a very big way. So we started, thinking how do we, make this hand hygiene as the main agenda of the community level. So in Gujarat, almost in coastal belt of Gujarat, we had our school management committees, and through school management committees, we had established soap banks in around 500 to 600 schools. So with that idea of, we had plans, we had mobilized community, like if any children's birthday is being celebrated, so village community will come and donate soaps. So in that process, the sustainability of soaps and hand wash liquids became kind of assured for 1 year or 2 years, and we realized this is becoming a permanent feature in those areas. However, when COVID came and public utilities were almost non-functional, so then challenge became how do we, ensure that community, individual household levels are also, adhering to the hand hygiene practices. So we started through our volunteers, through our Swachhata ambassadors, we started the door-to-door campaigning for hand washing hand wash practices. And that is how we used WhatsApp groups and other medium of communication to reach to the door to door. And the best part was we realized children became really a very enthusiastic change of agent. They started uploading videos within their villages. Like the system, what we developed for the awareness is all these Swachhata management committees through our other programs, they started developing their short videos and circulate it within their village, which, I mean, in that process, social distance, physical movement was also avoided, and the two-way communication was established from us to the Swachhata ambassadors and to the panchayat. However, when I come to area like Vasai in tribal areas where there is no water, there is no infrastructure, community is completely depending on groundwater. So in that area, we were struggling, like how do we promote hand washing when they do not have that kind of facilities. So we started looking for very, very practical and cost effective options. So and then we refer to few of the guidelines from WHO, from UNICEF in such kind of a settings, what can be done, and we worked out a very low cost techniques. For example, they have oil can with the opener. So we requested them, you can fill it up and keep outside your house, and which can be used as a hand wash station in whatever bare minimum setting they can have. Then second thing was this I'm talking in the very, very initial stage of lockdown situation when complete movement was stopped. So then we started telling them, they did not have soaps. The communities are extremely poor. So we ran a campaign within the villages, like all our soap banks which were at the public places in the schools could be given to individual families, and whatever the small pieces we collected from our own initiative from volunteers, the left out soaps were given to the community so they can make a hand wash at their own level. So after 2 months of the COVID, when the reverse migration started happening, that people started moving back to the villages, then it became another big issue. So we immediately motivated village panchayats to ensure that anybody entering at the village level should adhere to this at least hand hygiene facilities. At that point of time, there was no facility for COVID testing, and now communities are actually geared up for that. So then another thing, what we thought is we also promoted at the community for sorry, there's something. I mean, we also promoted, using of local raw materials in tribal areas for soap making. So we are still in the validation stage, but products like neem, aloe vera gel, and a few more things could be, the community has started initiating tulsi, neem, and other things. So one of the self-help group has, volunteered to do that experiment. Question which I want to put the panel here is like we were also working out option of in the worst setting where absolutely there's no water, and what could be the solution. We have been struggling on that, and a lot of literature was reviewed, and we reviewed even ash could be one of the option. Because traditionally in our primitive societies, communities were using ash, but there is no scientific evidence on that. So probably this forum or some NITM or UNICEF is also there. We can take it further, whether ash has any relevance in promoting hand wash in a setting where there is absolutely no water. So we cannot just close our eye, because that is kind of there are few settings still where water has not reached and community is depending on groundwater. That's all I wanted to say from our practical implementation point of view. Thank you.
Anita ji, thank you. And thank you also for raising this very important point, I think, of how can we look at alternatives to soap and water to ensure safe hand washing. And I think that we need to engage in a lot more research for that, but an important point for us to ponder. We'll now move to Ms. Mamta Bakshi from the Cosmo Foundation, and they also have extensive work experience in Gujarat and Maharashtra. So we would like to hear from the perspective of how can CSR programs really try and kind of work on hygiene promotion and behavior change intensively in communities. And Ms. Bakshi, just requesting you to keep your intervention for 5 minutes so we can have the other speakers as well. Thank you. Ms. Bakshi, are you?
Good afternoon to the. Yes.
Good afternoon.
Yes, I am here. Good afternoon to Sphere India, to all the panelists and all the participants. It's a privilege and it's an opportunity for me to share the experiences of what we have done in rural Gujarat and rural Maharashtra. If I take this entire journey, see, what we believe at Cosmo Foundation is that hand wash cannot be done into the isolation. We have done it in the backdrop of education and cleanliness both, because we started our rural intervention with government schools. We have partnership with 42 schools in Gujarat and Maharashtra. And across the schools, when we started computer literacy, basic education, English programs and all, we also recruited our teachers. And what we realized is that the teachers have to carry 3-4 bottles of the water, because for the hand wash before they start eating the tiffins, and also for the drinking water, etc. So we realized the problem. Second problem was that we identified is that students have no habit to wash the hand after the play, before their midday meal, after using the toilets, etc. Third is the no culture of creating a hand wash habit into the school curriculum system and even into the community. So what we started with the organization is that first of all, we developed a module on health and hygiene, and also the hygiene charts. Aankh ki safai, naak ki safai, daant ki safai, haath ki safai, and the hand wash is a part of it. So we developed this module, and students have to come and they tick mark the charts on their own into the classroom. So that's what we started. Secondly, when we are running the computer education, so how to integrate the hand wash in it. So we run a program called Paintbrush. So in Paintbrush, when they are making pictures, let us make pictures of good hand wash. So that is another thing which we did. Let us learn the vocabulary related to the hand wash in the English program. So these are the initiatives we started integrating. Another problem which we identified is so much of skin disease, diarrhea, worming into the stomach from the doctors, we came to know. So hand wash was the priority and hand wash was the need. So then we started encouraging students that anyone performs better in academics, anyone comes regularly with the neatness and cleanliness, we started giving them the encouraging gifts. And those motivational incentives were soap, napkins, water bottles, and etc. So encouraging them for the hand wash was another area which we did in a long way. Another initiative which we have taken is that we have tied up with the UNICEF Gujarat, and we have done across the schools, we have done the awareness programs like puppet shows, flashcards, storytelling. Every day during the prayer, we encourage them for the hand wash. And what are the real techniques of hand wash? We have developed series of videos, posters, flashcards, and IEC material in Gujarati and Marathi to educate the school children for and encouraging them for the hand wash. So this was the area where we started in the backdrop of the pre-COVID situation during our school programs. Another thing what we realized is that when we after the Swachh Bharat Abhiyan, when we constructed the toilets into the schools, first of all, we ensured the water facility. In Gujarat, we didn't have much of the problem, but like Maharashtra being a drought affected areas in Aurangabad districts, first of all, we constructed the water tanks. Then we asked panchayats to ensure the water facility, and that entire mechanism of the access to water was created. Then when we built the toilets, the integral part was the hand wash facility. So we created the hand wash facilities for the students and the teachers. Another thing which we realized is that in midday meal, every school cooks their own meal. And when they cook and they serve the freshly cooked meal, but the way the meal is served, they have to sit into the area where there is a dust. There is no proper sitting arrangement and there is no hand wash practice. So we prepared the Swachhata Samitis in the schools of the students, and in Swachhata committees, we every 15 days we do the lot of meetings, video educations, showing them the films, and values, what we want to change in the schools, what we want to change in our own homes as far as the hand wash is concerned. And then these students, we made the groups of 2 boys and 2 girls in each class. Before and after the midday meal, they stand near the water taps and they see to it that everybody in their classroom washes their hands, and then they go for the midday meal. And similarly, the properly hands are washed after the midday meals. We also prepared the monitoring charts, and which
I think Ms. Bakshi may be traveling, and that's why her connection may be a little lost. We'll just see if she's going to rejoin us. Okay, in the meanwhile, as she's rejoining us, let's just move on to our next speaker. So Joyji, welcome. So Joyji is with UNICEF. And we'd like you to talk about the important supply side aspects that will enable hand washing. And this will include, of course, facilities, access to water and soap, and how we can bring all this together to really reinforce those behaviors that both Anita ji and Mamta spoke about.
Ma'am, Dr. Mamta has joined back, Ms. Mamta.
Okay, so Joyji, if you would just hold on for another minute or so. Mamta ji, if you could just quickly wrap up in the next minute so that we can move on to our next speaker. I think you will have some questions in the chat box on the use of these hygiene clubs. So please do look at that and respond as well.
Yeah. So see, another thing what we did is the monitoring charts prepared, and that is being maintained by the students themselves. Okay, and what they are asking about hygiene clubs at schools and hygiene corner at school helps a lot. We have done with the help of Collective Good Foundation. Yes, we too have done, and we have also prepared the booklets and video. And if in a minute, I will just show you a couple of pictures. See, this is the pictures I'm showing, that this is the hand wash facilities, and even the committee is checking that whether the hands are washed properly or not. This is the facility which we have created in the schools, and students are encouraged. Recently, during the COVID-19, we have installed hand wash stands with water tanks and sensors in primary health centers. And the soaps are being installed by the soap is being provided by the primary health centers, and we are doing. Even in the government schools, the soap, we see the what fund is coming from the under the Swachh School Abhiyan to the government schools, and we add on, so that we can do the better facilities for the that, like soaps and napkins and everything. We have also encouraged students to bring their own handkerchiefs and how to make handkerchiefs. We have also done a practice that they can paint on their own and bring it. Recently, we have started a e-platform, DG Pathshala, and students are encouraged to wash their hands and send us the photographs. And you can see some of the photographs and some of the videos which students have sent us, that how do they do. This is the monitoring chart. You can see. Yeah. So thank you very much. And I also give you a glimpse of the video which we have prepared to educate the students.
Mamta ji, I think because of network issues, you may not be able to play this video.
Okay.
But thank you for those interested. If you could please write in the chat box, because we've heard some very good ideas, very simple, very practical ideas for what we can do at a community, especially at a school level. So please do reach out to Mamta ji. Sujoy ji, we're going to come back to you to hear about the how you're tackling the supply side factors to ensure hand washing for all.
Yeah, thank you, Arundhati. Can you hear me?
Clearly, sir.
Good. Can I share my screen for a couple of slides? You will have to ask Madam to unshare, I think.
Yes, Mamta ji, if you could stop sharing your screen so we can allow Sujoy ji to share.
I stopped it.
Okay, I think we can still see it. We'll just see if we can provide some support from the back end on this.
Yeah.
Sujoy ji, all yours.
Yes. So I think the examples we heard now from Mamta ji was amazing. School sanitation has been one of the priority areas for multiple years now. But I want to create some discussion into. It's all very good. I really congratulate everybody for the hand washing with soap and hand washing day today. We have seen, as my earlier speakers have said, tremendous reaction on social media. The Prime Minister has given a written statement on hand washing, which is all over media. The Minister of Jal Shakti, Mr. Gajendra Singh Shekhawat, has posted multiple videos on hand washing. We are hearing plenty of buzz. But I've got certain questions. Where is the money? How will this happen? You see, India, 1.36 billion people, 5,100 small towns and medium towns, 380 urban conglomerates, 630,000 villages, 27 crore households, 18 crore rural. I'll just give you a calculation, as you can see in the bottom of this slide. I am not going into household hand washing. I am assuming that by SBCC, IPC, behavior change, we'll be able to convince people to wash their hands in their homes. But what happens when they are outside their homes? If a village, you need one station in the bus stand, one in the market, and one, say, in the panchayat office. So in 6 lakh villages, you need 20 lakh house hand washing station. Each station, 15,000 rupees. This is the bottom price. Is 3,000 crores. Now, who is going to give the money? Are we getting funding for this? So where is the advocacy? There is the need for push. Where do we have to put? Homes, institutions, public places. We need people to wash their hands when they are outside the home. That is the way we have to prevent from COVID, in addition to wearing a face masks and physical distancing. But what do we need? As many of my early speakers have said, we need water. Water. It's great that the Jal Jeevan Mission is now launched and water supply will hopefully improve. The Prime Minister on October 2nd has also launched this 100-day Abhiyan to provide water supply in schools and Anganwadis. Well, that is a good initiative, but that also we'll have to see how it goes. Half the Anganwadis in India are in private buildings. Out of the 14 lakh Anganwadis, 7 lakhs, I think, are in private buildings. How do you put in piped water supply there? Many of the schools don't have piped water supply. So, but there is an effort there. So, this is attention we'll have to give. Then, of course, hand washing facility, if you have to build, you have to have an overhead water tank. You will have to have a station. You have to have a tap. If you are manufacturing it a bit away from that village, you will have to transport, you will have to install. You will have to manage operation and maintenance of that facility. Somebody has to go and fill the water in the water tank. Somebody has to make sure that the soap is replaced. Drainage, where does the gray water go? It should not stagnate in the village. So the where and the what we know, and how. I think the how is what we have to think from the terms of supply. You see, so for me, there are 5 or 6 things which I thought I'll highlight. Number one, for me, we should follow the principle of subsidiarity. Plan and implement what can happen at the lowest level. We should not wait that New Delhi ministry will issue an order or state government will issue an order. Planning and implementation has to happen at the bottom, at the GP level, at the community level, at the village level. How do we facilitate that? Arrangement of O&M before installation. Wherever we are putting up a station, the supply side, as is the operation maintenance in place. Somebody has to take the responsibility. Some agency, it could be a local government body, the panchayat or the ward member. It could be some market association, businesses, but youth clubs, SHGs. Somebody has to take responsibility. It should be sensitive to the COVID pandemic. So, of course, hand touch, pedal, uh, proper clean water, no wasting. Water supplies requires soap availability. We just heard soap banks, very good effort in schools. Can we upscale it to other places also? Who will contribute? Because you know what, hand washing without soap is not going to prevent us from COVID. Soap has to be used. Somebody asked the question I saw on ash. I was just going through research papers. There is no proof that ash can prevent infection transmission. It is soap which has to be used. It can be liquid soap and bar soap or various varieties of soap, but soap availability has to be maintained. Wastewater, I've mentioned. Public private community funding. Will the government pay for all these hand washing stations? Right now I don't see this happening. Why should the private agency pay? Will the private, so can we create a market? We can. There is demand. But the question is, where is the money? Can we create a partnership format where the community comes in and contributes to the facility that is being set up? Then we can also have an ownership system. If the community contributes for the facility, I'm sure they will make sure that the facility is it's operating and it's maintained. But this kind of planning has to happen to ensure that the funding is available. So the whole of the private sector, one of the things is CSR, but I don't know how far CSR can go. Our experience we have seen with school sanitation in 2015, when the Swachh Bharat mission was launched, the Ministry of HRD asked many corporates to come and build school toilets. And we saw hundreds and hundreds of thousands built. I know Airtel Foundation, Reliance Foundation, many of them had come and built. But the recent CAG report on schools has shown that 60% of those facilities are not functional because there is no operation and management. So private sector involvement has to be sustained. It cannot be I just come, put up some infrastructure and go away. So we really need to think this too. And the last point I mentioned here is on monitoring. There has to be a monitoring system in place. So responsibility has to be fixed for all the facilities that we are putting up. I have given, I'm giving you what worked in the Swachh Bharat on the right on this slide. Political leadership that we are slowly beginning to see today. We saw, we are slowly beginning to see hand washing maybe coming in the forefront. Public finance will be important to a certain extent, but financing from private sector, financing from communities will be critical. Gram Panchayat has to come forward and take the loan. They do have the money now in the 14-15 Finance Commission. They have to take responsibilities. Partnership was mentioned across the board. We need to do partnerships. And the people's involvement. Community has to take care of their facility. I'm just giving you 2-3 photographs, just want to show you simple solutions. Simple. These are, you might say these are not sustainable, not durable, but because these have been put up by the community, by a household, by a young child, they'll make sure that this run. This girl you see below, these two girls, this girl is called Ria. She is from Jhabua district in Madhya Pradesh. My colleague who just spoke before me, Pankaj Mathur, will know this story. But she installed a low cost, highly effective 2-bottle TP tap solution, which now has been multiplied in 7,000 adjoining villages of Madhya Pradesh. And the Chief Minister of MP has appreciated her action and gone on Facebook and tried to multiply. This does not cost anything, but we have to reach out and tell the people they can solve their solutions on their own. They don't need the collector or the UNICEF or any NGO to come and help them. They can do it. We have to send the message. And these are all easy to make designs. Local fabrication, the local mistri, loha wala, they can make this up. It's not difficult, can be done. So banks, wastewater, local solutions. Then of course the more complicated solution, where you need where you have larger footfalls, offices, where pressure is more, you can have foot pedals, multiple hand taps, etc. Water supply can come through water tanks or other water systems in the village. So there are solutions we can give. You have to communicate. We have to spread the message. Today I think has been a very successful day. Those of you who are in the wash sector would have seen across social media plenty of action, but this has to reach out to every community of the country. Sachin Tendulkar has put up a video on his YouTube channel on hand washing today. Amitabh Bachchan has put up a video on his YouTube channel. The message has to reach, and these are all advisories. I end here. My question is, the photograph you see here is our executive director of UNICEF speaking on hand washing, explaining we need to spread the message. We need to provide financial solutions to the community to set up. I stop here. Thank you.
Thank you, Sujoy for that excellent segue to our next speaker, Shalini. I'd like to also thank you for highlighting important points of public financing, political leadership, but at the same time, community ownership and engaging communities to come up with local solutions, and of course, the ever important O&M. So thank you for those points. Shalini, taking off from where Sujoy left off, how can we design, implement impactful behavior change campaigns? What's the role of behavior change in sustaining hygiene behaviors during this pandemic and well beyond it?
Thank you, Arundhati, and a very good evening to everyone. And thanks to the organizers again to organizing this particular webinar on Global Hand Washing Day. I will just go through a few guiding principles, as you said, of social and behavior change communication. And I will just share a few slides. So if I can just share my screen. Can you see it?
Yes, ma'am.
Yes.
Okay. So why hand washing with soap? Now, if I show this particular slide, probably to the audience who's listening to the webinar and to the panelist, it seems a thing which everybody knows. It is the first defense against COVID. It saves us from various diseases, be it diarrhea or other respiratory illnesses. We understand what are the benefits of hand washing with soap, be it direct benefits or be it indirect benefits. But why do people don't wash their hands? What are the barriers and challenges? And we've heard from several speakers now before me that there are multiple issues. And what we have primarily heard is about the supply issues. So we've heard that the most cited reasons for not practicing hand washing with soap is the lack of the place, the lack of infrastructure, the lack of soap, and the lack of access of water to wash their hands. But if we look at the behavioral issues, there are multiple behavioral issues both at individual as well as at community level. There might be low awareness about the benefits. There might be limited knowledge of the health linkages. There might be lack of information. There is a very low risk perception. And this low risk perception leads to the gap between knowledge and practice. Coming back to supply issues, if we look from a communication lens, we also need to have the supply of a workforce that has the capacity to communicate to people the right information, give them the right information about hand washing with soap. Just like Sujoy said just now, that if you're washing your hands with soap, ash, probably it is not really the correct way of getting the germs off the hand. So what is the correct way of communicating and what is the correct message is extremely critical, and we have a limitation of this particular workforce not having the capacity to communicate in the right manner. Then also the absence of customized approaches. I think what we heard from Anilji right in the beginning and from Pankaj, Anita and other speakers, that really for hand washing with soap to become a practice, a norm, we really need to have customized approaches for each and every segment of a population, and especially when we talk about marginalized population. And I must say also at times of emergency. Like Anilji said, when there is a disaster, there is a particular way that we need to promote hygiene, and especially hand washing with soap, which is extremely critical. So just going back to what I said in the beginning, what are the guiding principles for developing a social and behavior change communication strategy for hand washing with soap? We've already seen that it has to be evidence-based. Unless we have the understanding of what the infrastructure is, what is the knowledge, attitude, practice of the people that we are building that particular communication framework for, that particular evidence is extremely critical. We also need to understand who are the stakeholders. What is it that we want from that particular audience? What is the action? We are saying hand washing with soap. Now we have a call to action. But what is that action? And what are the things that are required for that action to take place? The strategy has to focus both on the individual as well as the entire community. It has to engage the community. It has to empower it with information and also ownership. We just heard the story of the very innovative set that the girl had made from MP and how it has been scaled up in the entire village. So that is extremely important, that there is ownership for a particular behavior. Advocacy with duty bearers. We cannot, overstate this point, that how important it is that, the right infrastructure be there, the water be supplied and the soap be there. Also, the service provider needs to have the capacity to communicate the right information. Of course, we need multiple communication channels to reach the remotest corner of the country, and partnership and coordination again has been spoken about much from the earlier speakers. So just to give you a general idea of what are the multiple kind of stakeholders. So while we have the general public, we also have various institutions at different levels where we look at capacity building and we look at multiple approaches for multiple stakeholders that are mapped, be it mass media, be it advocacy, be it social and behavior change communication. So for any strategy, we really need this stakeholder segmentation as well as to match this stakeholder, what is the communication approach through which we can reach that particular stakeholder. So that is extremely critical. And once we do the stakeholder mapping, it is really important that we understand what is the expectation from that stakeholder. For example, we spoke about advocacy. What is the enabling environment that needs to be created for hand washing to actually take place at the ground level? There has to be enabling policies. Do the policymaker have the evidence, like we just heard about the status of Anganwadi centers, about the status of schools? Is there a budget that can be used for providing that particular infrastructure? Is there a budget to develop a communication plan? Is there a budget to do capacity building of the frontline workers who will actually go and communicate the message? Is there a convergence between the different departments? Is one department providing the water and the other providing the frontline workers who are actually messaging about hand washing with soap? And is there monitoring and assessment about the entire program? Supply side, we've already heard much, but that is extremely necessary that these things be available for the demand side to happen. And from the community, we really need to share with them the information on what are the benefits of hand washing with soap, that they need to practice hand washing with soap at critical times, which is, I mean, most of the audiences know here what are the critical times of hand washing. They need to maintain this behavior post-COVID. A lot of questions are coming in that is hand washing with soap important only during this time? Once COVID goes away, we will not really need to wash our hands. Is the momentum which is being built up for this will die down once we are in a post-COVID stage? Also, the conservation of water. I mean, along with the message of hand washing, we need to, have the additional information about conserving water. And also every person needs to be an agent of change to promote this particular behavior. I think this is something now everybody is talking about, but we do need a 360-degree approach to promote hand washing with soap. And I'm not going into the details of that, just to say that advocacy activities and capacity building activities are equally important, along with interpersonal communication, IC, social media, and outdoor media. I just wanted to highlight something which has been spoken about very often these days, and that is Jan Andolan. UNICEF and other partners has been working with Swachh Bharat Mission as well as Poshan Abhiyan, and we have brainstormed on, bringing out guidelines for Jan Andolan, especially for the Poshan Abhiyan. And there are some key principles which I just wanted to highlight. And these are, it has to be aspirational. It is something that is aspirational for the entire country. It is a shared identity. It is a shared responsibility. And also about nudges, that something needs to be highlighted, which is simple, which is doable. People have the efficacy to actually practice the particular behavior. And rewards and recognitions. Simple way of how you motivate people to practice that behavior. The other day we were in a seminar on behavior change for hand washing with soap, and someone said that motivation, information, and facilitation are the three key words that actually sustains a particular behavior. Also, what are some of the key approaches for building a Jan Andolan? And I'll not go into the details of what is there on the slide, but just to highlight that convergence among all partners, be it the government, CSO, development partners, private sector, is absolutely critical. Engaging the community is also equally important. Partnerships we've already spoken about, and a multimedia approach. So these are some of the key guiding principles and key approaches that we need to look into when we are talking about a Jan Andolan. I would just like to end with the fact that COVID has given us an opportunity. It has created a very high impact on the whole concept of behavior change communication. And it has also created a momentum around hand hygiene. You just heard Sujoy say about the kind of buzz that has been created today on Global Hand Washing Day, be it the social media or even the mass media. So we really need to sustain this. And this entire approach of the global call of universal hand hygiene really needs to be promoted. So I will end here, and because these slides are kind of repetitive of what has already been said about the entire, the whole society approach, I'm not going to repeat it, but just to say that this is an opportunity where the ministries have come together, and if you look at the different campaigns and the programs that the different ministries are leading, all have hand washing with soap centralized to them. So making hand washing with soap everybody's business should be our next steps to sustain it. Thank you.
Thank you, Shalini. And yes, I think you've outlined very, very well how we can make soap everyone's business. but paying attention also to customized approaches and context-specific solutions. Thank you for that. Next, we want to hear from Kapildev Singh from IQVIA. Now, Manjeet and Dr. Anil opened and spoke about the importance of infection prevention and control. And Kapil, from your experience of being in public health, of working in the healthcare setup, how can we look at hand hygiene from the perspective of healthcare facilities, especially infection prevention and control?
So thank you, Arundhati. And there is a lot of discussion on, hand washing, and we are at the time of COVID, and a lot of awareness and attention towards the hand washing in the general public community at large. But we touched community, we touched Anganwadi centers, we touched school, but we also need to touch the healthcare institutions, because you will see diarrheal diseases can be reduced to 47%, but there is a major chunk of respiratory infections also. And, we can see the COVID, we can see the other respiratory problems. So largely comes the respiratory infections within the community, as well as from the health facility also. So, and at the health facility, not only community, but the service providers are also at risk. So when we see, so all these hand hygiene is not only contribute for health, they also contribute for nutrition, education, economic opportunities, and equity at large, and directly contribute to 8 sustainable development goals. So out of 17, hand hygiene, only hand hygiene contribute to 8 sustainable development goals. So when we say hand hygiene, that contributes to the morbidity and further mortality, as well as when we have morbidity, so it impacts the absorbing capacity of nutrition from the food. It impacts on personal hygiene, which create the challenges for the wages for the poor population. The population which is having frequently infected and having long infections due to the hand washing challenges. So due to which they pushed themselves into the below poverty line. So I can directly say that the hand hygiene contributes to the first of the SGD, which is no poverty, because of there is loss of wages due to the morbidity, which was contributed by the hand hygiene. Whereas if we'll talk about the nutrition, so because of the diarrheal diseases, the absorbing capacity of nutrition from food has reduced, and it impact on the nutritional status of the individual. Also, overall health and well-being, over 2,000 children across the globe in a day died just because of the diarrheal diseases. So we can see the impact of the hand hygiene at large. Along with that, there is in different geography, the vulnerable and disadvantaged group are severely impacted due to the hand hygiene in terms of the morbidity and mortality, and there are variation in the inequalities and economic growth within the geographies. Similarly, some of the speakers were talking about the schools. So when there are diarrheal diseases, children has to mark the absence into these schools, and in some of the cases when they are having long respiratory infections, there are cases of school dropout also. So that is also impact on the quality of education. So if we'll see directly, it contributes to the 8 sustainable development goals. So this is how they contribute, but important is how we can improve this situation. So when we talk about the health facilities, so we have to talk about, so Dr. Manjeet talk about the hand hygiene infrastructure, Dr. Sujoy talk about where is the money to improve the situation. So yes, I agree, but for that we really need to come up with the evidence and the regular information which can be provided to the leaders. So at this point of time, there are a lot of discussions, and Shalini has shared, and other colleagues has also shared the buzz about on the hand washing day, global hand washing day. So we can continue this, but we have to support it with the evidences. So we can develop the standards. So like healthcare standard, we can develop the WASH standard. We can develop the certification system into the Anganwadis, schools, and healthcare centers, where we can regularly collect the information. And we provide the Lakshya certification for the labor room and healthcare facilities. Similarly, we can provide the WASH certification to schools, Anganwadis, and the healthcare institution. So, when it comes into the regularity with the policy makers, with the decision makers, so definitely the funds flow started. That is what I would like to summarize, that we really need to focus on regular monitoring, engagement of technology, setting up the standard, setting up the process of certification, as well as the grading of the facilities. And according to that, the funds can be provided to the facilities for upgradation. So considering the time, Arundhati, I'll stop here.
Thank you. Thank you so much, Kapil. And also think specifically to look at standards certification for healthcare facilities, so we can really make sure that we're preventing infections, avoidable infections in healthcare settings. So thank you for highlighting that. Dr. Aravindan, unfortunately, will not be joining us this evening, but we do have with us Dr. Om Prakash Singh from Save the Children. So we'd like to hear from you as to what you think is the role of government, private sector, NGOs in kind of pushing and promoting the hand hygiene for all agenda. So if we could quickly hear your thoughts on this before we proceed to a short Q&A session.
Thank you, Arundhati. Let me just share my screen before I. Can I share the screen?
Yes, so you should be able to do that.
You have been made the co-host. You can share the screen.
Is it visible now? Is the screen visible?
Not right, not yet. Yes, it is. Yes, it is.
Yeah. Thank you so much, Arundhati, and thank you, Sphere, for giving us this opportunity to present. I think before I start on the role of government, private sectors, and NGOs on the provision of better hand hygiene facilities, I think my previous eminent speakers and panelists, they have set up a very right platform to talk about this actually. So just to summarize there, some of the questions that Sujoy sir, Shalini, they all raised about this. We should have the enabling environment to put in place from where the resources will come and how we are going to see it, what kind of behavior change, communication are we looking in, and what about the access to soap or hand washing stations and water supply. Now, here lies a major chunk of, when we talk about the roles and responsibilities in a grade. So in India, if I talk of, or in any country, if I talk of the government is the leading, the service provider in that sense. But going to a much more detailed kind of thing, just I would like to highlight, I think 2 or 3 points where we would like the government to take an appropriate action, at least on promoting the hand washing actually. So one of the things that we want, the policies supporting the hand washing at scale actually. So there may be the standalone policies on hand washing here, or we may have an integrated hand washing policies into various different departments and different government programs. Another very important thing that about the government's action is on the political leadership actually. And Sujoy sir, we rightly mentioned that today Prime Minister gave his statement, and the Jal Shakti Minister also, had his presence on the social media. But our submission is that these all things, this cannot be for a day actually. So hand washing is something that needs a persistent, regular, continuous effort from our government throughout the year and inbuilt into the all the programs. I'm not going to go into details, but very few, 1 or 2 examples that I would definitely like to cite and have a attention of the panelists and the participants here is that one of the important things is that when we talk of ODF plus and all those things, can we have hand washing stations as an important part of that? So that would build up a kind of promotion of hand washing. Can we have a separate specific budget lines for hand washing within the different departments when we talk of? Can we have, various ministries of health, education, or environment, they may coming up with their hand washing plans on a regular basis? Can this be inbuilt into the school's curriculum and part and taken ahead? Now, just another slide, I would like to talk about what the role the private sector and the NGOs can play majorly. I think I have just pointed out the 6 major blocks wherein we think that the private sector can have a role. One is on the product research and modification, wherein they can have, provide options for hand washing and latrines where there is unreliable water supply actually. So most of the time we were asking this question that where there is no water, what can be done? I think a lot of the research and modifications need to be done. Here is the private sector they can play. Can the private sector provide an affordable repayment options for household wash or community wash sector? Other thing that we are talking about that the private sector can also play an important role in providing low-cost delivery channels. How they can help in streamlining the hand washing supply chain altogether. How our government programs would be able to reach to the most marginalized and the most deprived population that can be. How these private sectors, they can play a major role in integrated hardware and software innovations. So those all things. Another very important aspect that private sector and NGOs can play is that they can develop an appropriate market-based approach for that. So right now, if we say the sanitation value chain, it is a kind of a disintegrated, every private players or CSRs or the development agencies, we have our fragmented approach in the terms of sanitation value chain. So can that be streamlined? Can the private sector, right now, if I see the private players like Colgate or SBCC or Unilever, they are coming up with very innovative campaigns, and during COVID times, we have seen some of them running down. So can we have a regular kind of approach on that? Another role where we see private sector is that they can support the entrepreneurs. Entrepreneurs in the kind of business planning and management training they can provide to private sector experts, to small wash entrepreneurs actually, who want to develop something. They can support in the product donations if they are willing. And some of them are still doing also, but then it needs to be done in an organized way. Another sector where the private sector NGOs can play is on the institutional partnerships. Institutional partnerships for capacity building of the government or private service providers. Plus also how the wash in the workplace, it can be strengthened further, and it can be part of their regular day-to-day activity. And finally, the private sector and NGOs can play a major role on advocacy, taking up the key issues with the government and how they can manage the knowledge management part on it. And the end, I think the private sector and NGOs can play a very important role in putting up that, the hand washing is not an individual's business, it is everybody's business. And there we all can converge our energy and work together. So that's all from my side. Thank you so much.
Thank you very much, Dr. Singh, for your very good insights into how we can really engage each of the sectors, NGOs, private sector, as well as with government. With this, we are at the end of our panel discussion. We have had some questions in the chat box, so requesting all panelists to have a look at that. But also, I see that Sphere India has put across their email for anyone who may have additional questions. We've had Pankajji and Sujoyji who have shared a number of resources for you to look at on hand hygiene with So Shubhangini, do you want to open up for the questions, or should we just do a quick wrap up?
Yes, ma'am. I can see a few hands, so I'll just do 2 or 3 questions quickly. Hello.
Hello.
Yes. Is it Nadeem Akhtar?
Yeah.
Yeah. You can ask a question.
Okay, thank you for letting me in. Well, first of all, I would like to thank the organizing committee and all the key persons for hosting this webinar. This is really informative, and thanks for that. My question is to Mr. Pankaj from UNICEF. First of all, I would like to thank him for giving us a very nice presentation about the evidences as well as the practices. Mr. Pankaj, my question is related to the reopening of the school and practicing, this hand washing. It is pertaining to adherence of the hand washing by the students at the school colleges, which are going to reopen soon as per the guidelines, and many states have already thought for it. So how school should ensure the practice is followed and adhered as per the protocols? And I'm pretty sure that, GI will come up with some detailed guidelines for the same. But how to ensure that these are practiced and supported in breaking the chain of transmission? So what's your take on it?
Okay, thank you very much. Can you hear me?
Yeah, please.
Yeah, thank you very much for your question. And again, it's a very pertinent question as far as, COVID is concerned and then reopening of schools. So, one is that there are a couple of informations which are there. I definitely would like to share with you. One is that, of course, Government of India and also, a couple of state governments have already come up with some kind of SOPs for opening of schools, which actually talks about that what is actually required before children enter into the school. Not just for the hand washing, but the overall wash and the overall infection prevention control. So this has, the detailed guidelines on disinfection of school, because some of the schools may have been converted into, quarantine centers or isolation centers during the COVID. So it has, the different aspects of how schools have to be sanitized before, children come to school. But more importantly, what are the basic wash infrastructure which is actually required in the schools, so that it's not just, we talk about the behavior, but children actually have the infrastructure within the school. And one big, the movement which is coming up in last couple of days, I think on 29th of September, but the formal declaration came on 2nd of October, is that now Government of India has committed that all schools will have piped water supply. So when I'm talking about the piped water supply, it's a kind of 100 days plans which Government of India has launched. So so piped water supply for drinking, piped water supply for hand washing facilities, and piped water supply for running water availability in toilets. So these are there in terms of policies which are already there, but now coming up as a priority, looking to the COVID and looking to the institutionalization of hand washing with soap. But again, you rightly pointed out that how it has to work for a longer time, because the infrastructure can be there. So my understanding is that, and my experience says that each and every school has to take responsibility of that, and I think teachers are the key, or school management committees or school development management committees are key. So if you really see, even the infrastructure part also, Government of India has identified as DMCs or teachers as the people who will be responsible for this wash infrastructure. But again, at the same time, promotion of the behaviors, and also ensuring that at least in the school premises, whenever children are there, ensuring that these wash facilities are there, they are functional, they are consumables are there, and last not the least is that that children actually follow that behavior. And there is something which talks about enabling environment in these schools. The last thing which I really want to say is that Government of India also has a program called Swachh Vidyalaya Puraskar, where the excellence in wash is actually identified every year, and the schools are awarded on the basis of that. So in terms of policies there, in terms of practices, there are some good practices coming up, needs to be shared. And again, at the same time, that the decentralized implementation and then monitoring becomes really very important. Yeah,
Right, exactly. Yeah, thanks a lot for the plan.
thank you very much. Thanks.
So I think we are running out of time. So I'll just wrap it up. And whomsoever has questions, they can mail at us. We have already mentioned the email ID in the chat box, or they can directly contact the panelists. So thank you, Dr. Arundhati, for effectively moderating the session. And thanks to each and every panelist also for such an enriching discussion. It was a wonderful session. So before ending the session, here are some administrative directions. Your certificates will be ready within 24 hours. Visit the website www.sphareindiacovid19academy.org, and you can download your certificate by scrolling down and finding the name for today's session. It will be ready to download in 24 hours. However, if you are unable to do so, as some participants may have faced the technical difficulties, just put a mail at COVID-19 Academy @sphareindia.org.in, and we will get back to you as soon as possible. Have a great evening and see you for the next session. Thank you so much for attending the session. Thank you so much once again.
Thank you. Bye-bye.
Thank you. Bye-bye.
Thank you.
Sphere
Bye.
India. Bye.